I recently had a 19-year-old patient who noticed a lump on her neck. She came to see me because she wanted to know what it was. Well, I told her it was a skin tag, and in this video I'm going to cover the essential topics that you need to know about skin tags. They're very common and you may experience one at some point in your life. Well, let's talk about those pesky little things called skin tags. Skin tags are soft, non-cancerous growths that can usually appear on skin folds like your neck, your armpits, your groin, and even your eyelids. These growths are caused by loose collagen fibers that have become stuck in areas where the skin is a bit thicker. Well, you'll be reassured to know that skin tags are incredibly common. They're also more common if you're overweight or have diabetes. These skin lesions are usually harmless, but they can cause you symptoms, especially if they're catching on your jewelry or getting pulled when you're putting clothes on like your bra. Skin tags can range in size. They can range from around 2 millimeters to 5 millimeters. You may notice that you get one of them, but you may also get a group of skin tags. How do you tell the difference between a skin tag and a wart? Skin tags are easy to confuse with moles or other types of lumps called warts. Warts are most commonly found on the hands or the feet. Most warts are firm and hard, usually a little bit rough, and raised above the skin, whereas moles are usually found in areas where you've been exposed to sunlight. They're usually a different color to the rest of your normal skin color. They can be pink, light brown, or darker brown, depending on the color of your skin type. Non-cancerous moles are usually round and oval and are normally flat to the skin. When to see a doctor about a skin tag? So as a doctor, I've seen many patients with skin tags, and often they'll come to see me. They'll be concerned or embarrassed by the skin tag. They'll often say it's getting bigger, more painful. Sometimes it can catch on their clothes and start to bleed, or they're getting more and more skin tags. It's usually a good idea to see a doctor if you've got a lump and you don't know what it is. And this is because we want to rule out the more serious conditions. How do you remove skin tags? Well, firstly to say, although skin tags can be embarrassing, we don't usually need to remove them. I recently had a 65-year-old patient who noticed a lump. I examined the patient and make sure I take a full history to find out how long she'd had it, whether it's growing, and how it's affecting her. She then said to me it doesn't really affect her, but she just wanted to know what it was. So then I reassured her that it was a skin tag, which is a non-cancerous lesion, and she said it doesn't really bother her, she's just going to leave it alone. Many patients prefer this approach as it's not generally harmful. However, if your lump is growing or you decide you want to treat it, what other options that are available to you? Ways that we can consider removing a skin tag: by using heat, by freezing them, or surgically removing them with a blade. Once a skin tag is removed from a certain area, it doesn't generally come back, but it will depend on your risk factors for getting skin tags. When you look on the internet about skin tag, you could get advice about tying a string around it and pulling it away. I advise my patients not to try this at home because sometimes they end up with bleeding, a lot of pain, and they don't always know it's a skin tag. I recently saw a patient who came to see me who tried to remove it and now had a lump which was just causing her a lot of discomfort around her neck and bleeding. I then had to refer her onwards to have it removed the surgical way. There are also home remedies that people suggest, like using oils or apple cider vinegar, but remember that not many of these methods are doctor recommended because there's not much evidence that it works, and in some cases using these chemicals on your skin could potentially do more harm than good. If you do have a skin tag, you might want to consider going to the pharmacy and asking if there's any over-the-counter methods that the pharmacist recommends. In some countries, you are able to buy some creams that you can apply on the skin to see if the skin tag goes away. These are commonly asked questions that my patients ask me. What causes skin tags? Skin tags usually form from friction between skin surfaces. So that's generally why it happens in an area where your skin has a crease, like in your neck or your groin. As you're moving around, your skin is rubbing together and therefore making you more likely to end up with skin tags. There's also other factors at play like pregnancy or diabetes or being overweight, which can all contribute to having skin tags. Do skin tags go away on their own? In some cases, if you have a small skin tag, it may just go away. However, most of them will keep persisting unless they're removed. But remember, they're not going to do you any harm, so if it doesn't bother you, you don't always need it removed. Do skin tags hurt? Skin tags are generally painless, So they're just growing. They might not look very nice, but they're not generally very painful. However, if you keep rubbing it when you're putting on jewelry or with your clothes, it can start to bleed and become painful. If I can ask for a favor, if you can click the word subscribe, it really helps my channel to keep growing. Thank you for watching.